Hi, I'm Carolyn Grimes. You're watching the Plastic Surgery Channel. Today you'll hear from some of the top board-certified plastic surgeons in the world. We'll cover everything from the newest filler product that can take years off your age to non-surgical plastic surgery. And we'll show you dramatic before and after makeovers. It's all straight ahead. Learn about the latest technology in plastic surgery today and how you can get quick and easy results with very little downtime. And find out if Botox or facial fillers is right for you. It's all straight ahead on Real Plastic Surgeons, Real Answers. What are you curious about? Our panel of doctors are here to answer your most personal plastic surgery questions. Do you have a plastic surgery question for our panel of doctors?
Well, I have these wrinkles in my forehead, and I don't know if I want to get Botox or filler, or which one would fix the wrinkles.
Well, this is a good question, Caroline, but what's more interesting is look at the age of this patient. She's 25, 30 years old. The safety profile of these products is so good that people in their 20s and 30s are having them.
I think they have to know that it's preventative at that age. The lines aren't deep, you're just kind of reducing the compression of the skin, and it helps them look better at an older age.
If a patient is asking about it, they can have it. So if they come to a qualified doctor, they can decide whether they need filler or Botox or both. But if you're concerned about these wrinkles, thinking about it, you should go to a qualified doctor and they can direct you and help you and treat you.
Because I think a lot of people have questions. They don't know the difference really between Botox and filler and which one goes where.
But think about the forehead for a minute and how far we've come. 20, 30 years ago, we would lift the forehead like we would lift the Phyllis Diller face. And now we're thinking more about the forehead as volume generation, restoration of volume in the temples as we get older. And I think the whole concept of forehead aging is really the last frontier in the face.
But to direct to that woman's question, Botox would probably be the magic bullet for her, wouldn't you agree?
Yeah.
Botox for wrinkles in the forehead, for the 11 lines between the eyes, and for the crow's feet. That's where we use Botox. And then filler, as Dr. Del Vecchio mentioned, for the temple areas and for deep wrinkles in between the eyes or in the low forehead.
I think the next wave in the forehead is going to be more volume and with biologics, with fat, because just like a breast implant lifts a sagging ptotic breast that's deflated, I think what we're going to see is fat in the forehead is going to lift the brow just a little bit by restoration of volume.
I think plastic surgeons now are realizing, like you said, Dr. Del Vecchio, that volume makes you look youthful. Not done, not tight, but just youthful. Fewer wrinkles, still animating, still being able to express yourself, not frozen, but natural.
And for people out there, you can't break a piece of aloe off of that plant and rub it on your forehead and get the same kind of effect that Botox or fillers will do for these things.
The next question may be the most important you'll hear today if you're considering any type of plastic surgery. Let's take a look. Do you have a question for our panel of doctors?
Yes. How do I find a reputable, certified plastic surgeon?
Well, the first thing you need to know is whether or not you're dealing with a legitimate board certification. The American Board of Plastic Surgery is the arbiter for plastic surgery, but the American Board of Medical Specialties licenses these individual specialties. So you could get a bogus board. Some people will use that as kind of an imposter to gain access to the consumer, and that really can impact on your care.
If you want to find out if your doctor is board certified, you can go online and look at the American Board of Medical Specialties. There are 24 medical boards that are sanctioned, and you can find out if your doctor is board certified. I was at a colleague's office to chat with him about something other than medicine, and I saw a plaque that said he's a board certified cosmetic surgeon. And for $450, you can send money to a different state and get that plaque, but that doesn't mean you're a board certified surgeon. You should look online at the American Board of Medical Specialties.
Today more than ever, all types of physicians, from ER doctors to OBGYNs, are getting into the lucrative field of plastic surgery. The result can be devastating: botched surgeries and sometimes even death.
Dr. Nedra Dodds defending herself against allegations of negligence following the death of a patient who had liposuction at her Kennesaw facility in February.
I think a lot of doctors are jumping on board because it's easy money.
When Gail decided she wanted facial fillers, she turned to the internet to research a board-certified plastic surgeon. She knew the importance of finding a board-certified plastic surgeon because she works with attorneys who are board-certified in the area they practice.
And it is important that you see somebody who is a specialty in that certain field that you're looking for.
Dr. Lou Bucky says Gail is on the right track. He says there are 3 basic questions to ask when scouting out a plastic surgeon.
Are you certified by the American Board of Plastic Surgery? 2, do you have an affiliation with a hospital? And 3, how many of these operations do you perform each year?
But here's the problem. There's a lot of bogus boards out there. Take a look at this popular doctor's website. He performs plastic surgery, yet he's really certified as an OB doctor. Let's take a look. Certified through the American Board of Cosmetic Surgery. That's your first red flag. This means he's not board certified in plastic surgery. Another one, he's board certified in anti-aging and regenerative medicine. Sounds impressive, but maybe not.
Sometimes if you don't ask the question specifically, they'll say, oh yes, I'm board certified. Well, they may be board certified in OBGYN or family practice. Well, that's nice, but what does that have to do with plastic surgery?
Unfortunately, it means the patient has to follow the buyer beware philosophy. There are lots of other boards that have official sounding names that don't have these same sorts of requirements. Some of them, all you have to do is send a check and they'll send you back a nice certificate for framing.
If you don't see these logos on a doctor's website, you may want to think twice. Next time you're considering any type of cosmetic procedure, Gail has some advice.
Do a lot of research, talk to referral patients, and do their homework because it's important to know the type of doctor that you're seeing for the certain procedure that you're doing.
Is this a big problem for patients and going to a doctor who's not board certified?
You know, 20 years ago, if something was printed, it was valid because it took a lot of time to print something. Now you can put something up on the internet, and just because it's written down and printed, it appears to be valid. The point here is that anyone can put anything on the internet and make it look legitimate, and it's not. And I think the customers really need to do their own work. You're going to spend $3,000, $4,000, $5,000, $10,000 on an operation. It's like buying a car. Do the background check on the car, do the background check on the surgeon.
And you could be a gynecologist and be board certified or any number of specialties, and that would make it sound like it was legitimate, but you're not a plastic surgeon and they're still doing cosmetic surgery. That's the confusion for the consumer.
And the advertising's misleading. I think you have billboards, they don't mention what they're board certified in, and that's really a problem because you assume because they have good before and after pictures, they have a nice billboard, looks like a nice office, that legitimate, and they might not be.
Good point. Coming up on the Plastic Surgery Channel, discover the latest device for facial skin tightening. Can it replace a facelift? Plus, the stem cell facelift. Is it real or just hype? Have a question you'd like to ask? Log on to theplasticsurgerychannel.com, find the Ask a Doctor button. You'll get an answer from one of our board-certified plastic surgeons. Physicians trust Biocorneum Plus to heal scars quickly. The first and only FDA-cleared scar management product with silicone and sunscreen.
The Plastic Surgery Channel is recognized as the only multimedia outlet exclusively owned and operated by board-certified plastic surgeons. Plastic Surgery Channel members are world-renowned and considered top in their field.
And that's been one of my areas of research focus for the past 15 years.
Your association with PSC will place you in an exclusive group, but our mission is much deeper.
Using traditional and online media, PSC's goal is to educate, inform, and influence. This segment of the Plastic Surgery Channel is sponsored by Pacira Pharmaceuticals, makers of Exparel. New technology in plastic surgery is progressing faster than ever. Never before has it been easier to get dramatic results with very little to no downtime. Here's our Plastic Surgery Channel doctors to tell you more.
Stafford, what can women do that doesn't hurt, is non-invasive but gives them some results as far as their face is concerned?
You know, today is a great day to be a plastic surgeon. We have new technologies that are non-invasive, no downtime, where patients can come in and have a procedure and get tightening and lifting of their skin. Before, we only relied on surgery, which was a procedure that was done under anesthesia. Now we can do things which don't require any downtime. They can come in at lunchtime and have the procedure done.
And it'll be noticeable, the results? Do you think you can actually see it?
I've had it done.
Yeah.
It works well in any age group. It develops new collagen and elastin. It tightens the skin and lifts the jawline and the brow line.
Well, do you think it'd work on me?
Well, it's worked on me, and you really don't need anything done. But on any patient, it can develop new collagen and elastin and lift and tighten.
It's nice to know we have this technology now.
It's a great new technology that we can employ that we didn't have years ago.
And there's no downtime.
All right, you want to look better, your face is starting to sag, you have changes in your face, or you want to be preventative and keep your youthful look. We have a treatment for you. It's called Ultherapy. Ultherapy is a new technology where we use ultrasound that penetrates the skin, and the energy that it gives creates new collagen. So you can come in, no downtime, any time of the year, with a tan, without a tan, young or old, and have Ultherapy treatments that will improve the shape of your face and give you new collagen. It's really amazing. It's a new treatment that we have available for women specifically who are thinking about doing something for their face because they're getting jowling or a little extra neck skin, and they want to look better and they can't figure out what to do, and they think, and I think sometimes, they're not ready for surgery. So we have an alternative. This treatment also works for younger people who want to maintain the collagen and maintain that youthful look. So it really runs the spectrum of treatment for the face to keep the face looking younger. Ultherapy can treat your forehead to give you a lift of your brow. It can treat around your eyes to help with the wrinkles and the fine wrinkles and tighten around your eyes. It can work on your cheek and jowls to get rid of the jowling, and it can tighten the neck skin along the upper part of the neck and reshape the lower part of your neck skin as well. You can be ready for an event next week. You can look better several months down the road. Anyone who wants to look better that doesn't want a surgical treatment, Ultherapy is the answer.
The stem cell facelift is one of the hottest topics in plastic surgery. But is it a worthwhile procedure, or is it just hype?
I feel like this only comes around once every 4 years.
Pitch woman Eva Campbell-Morales feels at home in front of the camera.
Then pay no interest for 2 full years.
But when the actress hit her early 40s, she says her slim build took a toll on her face, making her look gaunt and old. But doctors agreed she wasn't a good candidate for a traditional facelift, so Campbell-Morales,
and we're preparing to do the stem cell facelift,
turned to a new controversial procedure called the stem cell facelift.
Just a few minutes, we'll start the stem cell lift.
Documenting every step as a Beverly Hills dermatologist used liposuction to pull fat from her thigh and inject it into the hollow areas of her face. But what can't be seen is what's described as the secret stem cell harvesting process.
There's a secret procedure that takes place here.
Afterward, Campbell-Morales, still swollen, appears happy with her plumper look that she says restored structure to her once sagging face. Still, this has plenty of critics who say calling the procedure a facelift is wrong. There's no cutting or sewing skin. Some believe doctors are taking harvested fat and spinning it in a machine and putting it back, potentially just taking some stem cells along. Really, they say it is fat grafting, which has been around for decades.
It appeals to the fantasy of patients, but is based on no data at all.
Plastic surgeon Lou Bucky says there isn't solid research, only marketing hype surrounding the procedure. He questions whether stem cells are really being used, advising a good dose of buyer beware.
Best case scenario, a patient spends a bunch of money and gets no result. Worst case scenario, a patient spends a bunch of money and not only doesn't get any result, they get a bad result, have a problem that then needs to be fixed.
Here's the problem for consumers. If you do a Google search of stem cell facelift, you'll find that there are lots of doctors doing this procedure. There are even some doctors trying to trademark what they're doing. Well, that's really confusing for consumers. And right now, the peer review is still out on this. So industry analysts are urging caution.
I don't think any of us have the answer to that question.
Austin plastic surgeon Rob Whitfield is concerned that consumers are paying more, $5,000 to $10,000, for a procedure that may not deliver a better beauty fix.
And if you use stem cells as your connection to the fountain of youth and you feel like that's the next best thing to do, that's on us to prove that it does work as physicians and surgeons and not take advantage of people in their ever-ending, never-ending journey to find, a youthful appearance.
Now it lacks by 3 complete rooms of furniture for...
But Kamba Morales is a believer. Within days, she says she was healed and ready for her close-up. But experts say it will take time to tell if this procedure is a gimmick or real medicine. Dawn Tongish for the Plastic Surgery Channel.
We have qualified doctors here. Is this hype or is this real medicine? What do you think, Rick?
I'm inclined to think it's a little bit more smoke than substance. We all know that fat grafting is really a powerful tool to augment the face. But, I wonder, Dan, how can we reliably know that we're going to return stem cells to our patients?
Well, guys, we know stem cells do things that are amazing. I mean, there's no question about it. We've been doing this 10 years now. There's definitely science behind it. The question is, are we morally irresponsible to go out there on the internet and on TV and talk about stem cell facelift? Is the stem cell facelift, what we're doing now, anything close to what it should be in real life? Meaning, it's probably not. It's probably smoke and mirrors. But there are 2 issues. One is the marketing responsible that we see now? And the second question is, do stem cells really work? And I think they do.
Well, the more specific question is the science there for doing a stem cell facelift? And I don't think we're there yet. It might be in the next several years, but the science is not there.
I think that the science of stem cells is there, Stafford. I think that responsible clinicians have to do some really good clinical studies using stem cells in the face.
But then to label it as a facelift?
That's not ready.
Okay.
But we're definitely doing the studies right now.
Wouldn't we all agree, though, that it's really fat? Fat is doing the magic to the face when these so-called stem cell transplants are being done.
I think in today's marketed stem cell facelift, it's the fat that's doing it. But as Dan has mentioned, I think there will be a time when we have stem cells that we can then put into the face and get some impressive changes.
Yeah, I mean, look, fat has more stem cells in it than bone marrow, 100 times more. There's tons of stem cells in fat. The question is how do we get the stem cells out of the fat, and how do we isolate those stem cells and get them into the skin? Nobody treats the skin. What do we do to the face? We pull on it, we burn it, we inject fat underneath it. Do we do anything to the actual skin? We put some topical ointments on it. We're not getting into the dermis itself. This is the last final frontier in anti-aging, is to get product, biologics, into the dermis.
So that's the science of a facelift if you're using stem cells.
I think that the concept of, quote, stem cell facelift is a marketing ploy, and it's not a lift. My whole interest in the use of stem cells in the face is to get active cells into the dermis to regenerate aging skin.
But when we see videos like this where they say, I'm using stem cells and it's a magic formulation that no one else knows, that's not what we should be telling our patients.
I think we can all agree that that's a bad thing.
Dan, you talked about getting them into the skin. How do you propose that we're going to do that?
Well, we don't have time, Rick, to talk about the new technologies and the new techniques, but there are definitely ways to introduce product into the dermis. People have been talking about topical agents to penetrate the skin for years. Revance is a topical Botox product. But I think we're on the verge of being able to actually treat the dermis directly.
Still ahead, dramatic before and after plastic surgery makeovers. And coming up, taking fat from one area of your body where you don't need it and putting it where you do. Sounds like science fiction, but it's being done and with great results. Stay with us. This segment of the Plastic Surgery Channel is sponsored by Pacira Pharmaceuticals, makers of Exparel.
The Plastic Surgery Channel is recognized as the only multimedia outlet exclusively owned and operated by board-certified plastic surgeons. Plastic Surgery Channel members are world-renowned and considered top in their field.
That's been one of my areas of research focus for the past 15 years.
Your association with PSC will place you in an exclusive group, but our mission is much deeper.
Using traditional and online media, PSC's goal is to educate, inform, and influence. Biocorneum Plus, a proven silicone scar treatment with SPF. Easy to use, dries quick and clear, and makeup applies effortlessly on top. Welcome back. We all love to see makeovers. Today we're going to show you a popular plastic surgery procedure that delivers remarkable results.
Thanks, Carolyn. This is a woman in her early 40s who shows a lot of the stigmata of typical pregnancy. So she's got loose skin, she's got stretch marks of the abdomen, and she also has lost some breast volume. So what we can do is we can offer her something that's only available when you're doing a tummy tuck, and that is transabdominal breast augmentation, or TABA. And we start by making our incision very low in the abdomen so the scar is nicely hidden, and undermine the abdominal wall like this, and introduce the implants in this direction up here. And when we're done, one of the areas that's been stretched out needs to be tightened up. And for years it's been a problem because we have to use lots of narcotics, and I'm so fortunate that Dan turned me on to Exparel a few years ago, and I can't thank him enough for that. Dan, maybe you could tell us a little bit about Exparel.
Sure, Rick. I mean, Exparel is basically a long-acting Novocaine that lasts 72 hours, so these patients can go home the same day or without pain the next day. And it's certainly become a major part of my practice. Rick, I just wanted to comment on this result. I mean, what you have here is a patient who has a relatively square-looking body with narrow breasts, a stretched-out waist, and Rick has nicely, without any breast scars, placed implants to give her a wider breast, a narrower waist, and more of an hourglass appearance. So congratulations to you, Rick.
Thanks so much. We're rolling the dice anytime we make an incision on the breast. Some people will get a bad scar, some people won't. If you talk to a woman, 9 out of 10 will tell you, I don't want a scar on my breast. After a woman's had a number of pregnancies, the abdomen gets stretched out, often have loose skin, stretch marks. They have deflation of their breasts, sometimes they're sagging. The operation is called TABA, it's transabdominal breast augmentation. It's really something that most people would refer to as a mommy makeover. We've all done in our training breast reconstruction, where we take that big piece of flesh from the tummy and we tunnel it under the abdomen and we make a new breast. Why not do the same thing with an implant? And the implant is so much smaller. Instead of an additional incision on the breast that can make a noticeable scar, the implants are placed in through the abdominal incision, and it's actually the most kind way to put an implant in terms of the shear force on an implant. It just glides right in. So it's a win-win. You finish and you look in the mirror and you say, I got my body back.
Our next before and after makeover demonstrates how some highly trained plastic surgeons can now take fat from one area of our body and place it in an area where we need it. Dr. Dan Delvecchio is world-renowned in this type of procedure.
Well, Rick, this is a really interesting case, one that we all see. This is a patient on the left who's had breast implants that are too large for her, and a couple of things are going on. One is the breast implants look really unnatural. There's not enough soft tissue covering them. The second is that the implants are in different levels, and that looks not appealing. And so the solution might have been to take these implants out, put new implants in. That's the usual move. Here we've developed a new operation called Simultaneous Implant Exchange with Fat, where we basically take the implants out completely and put fat in the breast and fill the breast with natural fat. And you can see the result is much more natural, better symmetry, better slope of the upper pole, an overall better result.
It's a really sweet result, Dan. I love how you increase the silhouette on the lateral aspect of each breast, And not to mention, I'm sure you took quite a quantity of fat, and she must look better behind. Can you tell us a little bit about where you got your fat from?
Well, you know, these thin patients, Rick, you really need to get the fat anywhere you can get it. So lateral thighs, medial thighs, a little in the abdomen, a little in the flanks. You're just basically trying to get as much fat as you can from a lot of different areas, and it works out pretty well.
Up next, our board-certified plastic surgeons debate hot topics in plastic surgery. Surgical versus non-surgical fat removal, which is better? For more information, visit us at theplasticsurgerychannel.com.
The Plastic Surgery Channel is recognized as the only multimedia outlet exclusively owned and operated by board-certified plastic surgeons. Plastic Surgery Channel members are world-renowned and considered top in their field.
That's been one of my areas of research focus for the past 15 years.
Your association with PSC will place you in an exclusive group, but our mission is much deeper.
Using traditional and online media, PSC's goal is to educate, inform, and influence. Biocorneum Plus, the only topical silicone scar treatment product with proven results in clinical studies. This segment of the Plastic Surgery Channel is sponsored by Pacira Pharmaceuticals, makers of Exparel.
Really a big hot topic, fat removal. Surgical or non-surgical? Stafford?
This is the 21st century, Dan. We can do a lot of things without having to go under the knife. You don't have to make an incision and in a vigorous way pull out that fat. We have cool sculpting, we have all therapy, we have other ways to treat fat than just surgical excision.
Fine, fad schmad, what else you got? I'm a surgeon, I do surgery, I don't use a knife to do lipo. Here's the point. 20 years ago we had these big liposuction cannulas that are this big, now we have really small ones. Think about the technology of the cannula, not the technology of non-invasive surgery.
Granted, I will give you that you can take out fat with small incisions, but what about the person who wants to have no surgery? Do we say, you know what, you can't have anything, there's nothing we can offer you? There is something we can offer them.
I completely agree. If the patient doesn't want surgery, then they shouldn't go to the surgeon. They should go to you.
Well, that's a difference in the way we look at plastic surgery. We offer the whole gamut of treatment. We don't just offer a hammer to everyone. We have the whole toolbox.
I agree, Stafford. You know I love you. There are definitely places for non-invasive fat reduction, but I think the message here is that with better cannulas, you can take out fat safely in thinner patients. We can both be right, can't we? It's like a French movie.
We're both right, and you're a master, so I'll agree with you.
That's great information. I'm going to grab the fire extinguisher. I hope you enjoyed it.
To learn more about the latest tips, techniques, and trends in plastic surgery, visit us at theplasticsurgerychannel.com. Follow us on Twitter and like us on Facebook.